Greetings. I'm eager to see who's joining us today. It looks like people are coming on. I'm Laura Williams with Global Rights for Women, and we'll be introducing others here in a moment. Let me give people a moment to join. While you're doing that, if you have an additional device, since we're all connecting virtually here, if you have an additional device like a smartphone, laptop, browser, but you can still see us, we'd love to invite you to join our session in a second way, which will allow for some interaction with you, some polling, in addition to the way this happens with our Zoom webinar format. This would allow for some additional connection. So I'll go into this more in a moment, but while we wait, if you go to your smartphone and go to your browser, menti.com, you'll see the code here at the bottom of the screen, or if you want to take a screenshot of that QR code, that should get you there. It's new for me to try, but maybe Pat or Sophia, do you think we've got folks on now? Try and, or should
Yeah,
we
you
wait a
can
minute
probably
longer?
start in about 30 seconds.
Okay. So I think we've got almost 30 people. We've had more register. They may be coming on. But again, I want to welcome you. My name is Laura Williams. I'm at Global Rights for Women. And this is the Commission on Status of Women session on disaster preparation and thinking about a survivor-centered coordinated community response. I want to start with some introductions. I'm pleased to be joined by Comfort Dando. And unfortunately, we learned this morning that Carlan Joseph from Haiti, a colleague from Haiti, is having internet disruption, and she may come in at any moment. She may not. She has sent some remarks, and we all had a moment to reflect on how fitting it was for our session today that these disruptions have happened. So from Haiti to northern Minnesota, my colleague Melissa Skaya, also with Global Rights for Women, has had a power outage. And she is also working at a disadvantage, and so she will not be joining us today. I will tell you a little bit more about Melissa's background, and I'll take up some of those portions of the presentation as well. We do have two other Global Rights for Women colleagues with me. Sophia's working in the background to help produce and connect people, monitor the chat, and Pat or Patricia is going to step in for us, our communications director, and share Carlan's remarks if Carlan is unable to join us. But before I go further, I'd like to Comfort, if you could introduce yourself and say a little bit about yourself, and then I'll have Pat sharing some of Carlan's words of introduction.
Absolutely. Thank you. Thank you so much. Thanks to Global Rights for Women for having us. And also thank you to the UN Commission on the Status of Women for having us on this space. My name is Comfort Dondo, and I am the founding executive director of a culturally specific nonprofit that was founded here in Minnesota. It's called Pumalani, Minnesota African Women Against Violence. I am a global woman, so I just recently became a US citizen, but I'm also a proud daughter of Zimbabwe, currently based in Minnesota. Thank you for having me.
Thank you so much, Comfort. And Pat, would you share Carlan's words of introduction about her context and background for us?
Yes, and I'm honored to share this information on behalf of Carlan. She says, first off, I would like to thank Global Rights for Women for giving me the opportunity to speak at this session. My name is Carlan Metaye Joseph. I was born in Haiti and still live there despite all of the turmoil circulating the area. I am the founder of Fondation Essence L, a nonprofit organization created mostly by women in 2017. It aims at serving the Haitian community through a better social integration by improving the living conditions of vulnerable people. Foundation Essence L intends to economically empower women, provide balanced quality education and healthcare for youth and children, all while advocating for women's rights. Education plays an important role in our mission, knowing that it is an unconditional mainstay in improving the living conditions of vulnerable people and a determining factor in the fight against poverty and violence against women and girls. Fondation Essence L is committed to taking actions that promote women's empowerment through training programs and sustainable economic projects in sectors such as agriculture, fishing, salt marshes, farm animals, handicrafts, etc. The objective is to create resilience, autonomy, and know-how, especially among those living in rural areas. Our main areas of intervention are education, empowerment and socioeconomic development of women and girls in particular, women's rights, environmental protection and sustainable development, and health. Thank you very much.
Thank you, Pat. And Kurland, if you're watching this recording at some point, we miss you terribly. I came to know Kurland and her work as Global Rights for Women, was fortunate to work with her in a project in Haiti and collaborate with Kurland and the organization she was working with then to interview survivors, and know she has so much to share. So we'll hear a little bit more from her written remarks in a moment. Before we go further, I'd like to share a little bit more about myself and Global Rights for Women, and then we'd like to find out who all of you are. So my name, as I said, is Laura Williams. I'm the Director of Systems Advocacy for Global Rights for Women. I've spent most of my career in working on sexual violence and the response to sexual violence, particular with interagency or multidisciplinary teams, the coordination intersections for how communities respond. I joined Global Rights for Women in late 2021 after some consulting with them, and I couldn't be more pleased to be with them. My colleague, Melissa Skaya, is the Director of International Training and used to work with the organization that created the Duluth model of coordinated community response. So in a moment, if our polling is working, I'd love to find out kind of what brought you to this session. And if it's not working, I may ask you some questions to put in the chat. Stacy's lifted us up and started us off with some introductions in the chat. And so I will, let's try the Mentimeter chat here before we go further. So actually, before we do that, I did want to take a moment to just really think about the times we're living in. I know that today, even as we gather, there are crises, disasters happening around the world that touch us, touch people we love. They may be hitting the headlines, they may not be. And we want to take a moment because we know that's on our hearts and minds. And I wanted to share this picture. I chose this picture. It's of Ireland, and today in the US at least, we're observing St. Patrick's Day. And of course, Irish people, as people in many places around the world, have moved through periods of resistance, struggle, survival. And I wanted to observe that and have that in our memory as we take a moment to think about those who are feeling silenced right now, who are struggling, as well as those who are reaching out, and honor all of that. So I'm just going to take a quiet moment to center ourselves and invite you to do so as well, and deep appreciation for your taking your life energy to join us today for this discussion. Thank you. So now, as we move to the polling, if you might have joined us there. We'll see here in a moment. If you have a smartphone or on a laptop browser, you can go to menti.com and enter the code here at the bottom. If you click the thumbs up like someone has, you'll let me know how many people have been here. If you have a question about the process, you can click that. There's the code, or you should be able to hold up your smartphone right to that QR code, and that should take you right to this polling location. So I'm going to wait a minute more as people join. Just see, at least we've got, looks like 8 people or so. So that'll give us some information. If you're not accessing through that device, that is more than fine. When I ask a question, feel free to put it in the chat. I would say that, I should have said this earlier, we are recording, and we know that the recording will be available to people beyond this place and time. If that means that you might prefer to choose an alias for your identity or something else, please feel free to do so. So we have more people joining, it looks like. So let's start with this first poll, just to get our practice down and help us see where you are. You should be able to take your device or a dot that should show up on your screen, and you should be able to place it on this map. Tell us where you're joining from today. So I see a number of people coming from the middle, maybe some in Canada. It looks like the North America. Nadia, you didn't get the code. Sophia's putting it in the chat again. Hopefully you can see that. 9009 0645. Yep. So for those of you new to Mentimeter, as people fill out the poll, I'm seeing the number at the bottom right. So that tells me where we're at and how many people have joined. And then we're getting some people in placing their hellos in the chat itself, which I invite you to do. Hello, Elizabeth from Nigeria, and Stacy in Wichita Falls, Texas. Welcome to everybody. So this gives us a good sense, at least a good share of our audience is. Thank you. All right. So now I'd really love to hear a little bit about your interest in the topic. Oh, I see a lot of people coming in with their location in the chat. Thank you. Keep doing that. That's really helpful. If you are in polling, if you could take this next poll, what's your interest in the topic? And you can choose more than one, I think. I set it up that way. I'll just make note of this. And if you're choosing something else in particular, or if you don't have access to this version of the polling, I'd love to have you put that in the chat as well, so this will help Comfort and I think about our remarks a bit, kind of what your interest is. So we had 5, we've had 5, 6, 7, something else's. Welcome, Zoe. I happen to be located just a little bit of south of you, I think, or maybe east in Southeast North Dakota today. So glad you're here. Cheryl, run a home for women who are survivors of significant trauma who come to the US from around the world. Thank you. Better intervention program facilitator, Isaac, thank you. Great. Sophia and Pat, can everybody see when we get chats? Does that go to everybody as well? Do they see each other's messages? Do you know?
Yes, if it's coming to everyone, everyone can see it. Some, if you do choose to say it privately, just select host and panelists instead of everyone, which is a little blue button there.
Okay, perfect. Thank you. All right. All right. Oh, we've had more join. This is excellent. So we have 3 members of a CCR, 11 who want to know what a CCR is. That's helpful. A number of service providers, 1 person involved in disaster response, and a number of people who plan, train, evaluate, and a few something else's. Okay. Excellent. Thank you. Thank you for your sharing that. So let's start by defining our terms just a little bit. There's probably a number of ways to think about disaster. I just want to share how we've been thinking about it for our time together today. We're thinking about it as a serious disruption to the functioning of a community or society that causes widespread loss and impacts. And that I think this is a key feature that exceeds the ability of the community to cope using its own resources. So it's that level of disruption, something's happening and kind of a breakdown is occurring. So as you think about that, what disasters have been happening in your region in the last 2 years, whatever your association is with the topic? And think about your region at whatever scope that makes sense for you. It might be your neighborhood, it might be a community. If you're running a series of programs that's global, maybe you want to be thinking about all the locations around the world where you have colleagues. Whatever makes sense for you, we just want to get a sense of what you're thinking about at the moment. We see some other people joining us. Thank you. Feel free to join the poll while we take a minute here on menti.com. The code's at the top of the screen. And feel free to enter in information. Those of you who are just joining, you may not be aware we've had our own apropos to the moment in the session. We've had a couple of our panelists who aren't able to join because of power outages in their area. We will talk more about that in a moment. I'm going to wait just a couple more minutes because this does take some typing in, and I think it's just really helpful information to have at our disposal here. COVID-19, climate change, civil disobedience, forest fires, drug epidemic, racism and discrimination, political heat waves. As you continue to do that, let me just explain kind of a little bit about how we've organized today. We'll explore with Comfort's remarks and Kurlan's remarks a bit about their experiences thinking about disaster, and particularly the heightened risk of violence against women and girls in times when this disruption happens. Or the instability happens. And we know that can be kind of a contained short moment in time, or it can be quite long, as some regions of the world and countries are experiencing. And then we'll think together about the strategies to include in disaster prevention planning, including the role of interagency coordination and coordinated response teams. That'll be a time when I'll tell you just very briefly about that concept. I know 1 or 2 of you may be involved in that. We can explore that. We can also stay pretty general about just the concepts involved. And I know some of you are involved in disaster planning, and it looks like someone's doing a PhD in regard to this. We want to tap into your wisdom as well and kind of think and talk together about ideas. about how we should all be thinking about preparing for disaster to mitigate the impacts on violence against women and girls. And I'm seeing some more examples in the chat: political corruption, domestic violence, help women and their children, homelessness, unsupported asylum seekers, racial violence. Yeah. All right. Boko Haram insurgency, police brutality. This is all very helpful. So with all of this in mind, we think about disaster in pretty broad terms, right? We know they can be caused by natural circumstances, right? A number of these: volcanoes, heat waves, flooding, earthquakes, forest fires. But we also know that they can be human caused, right? War, drug epidemic, the Dakota Access Pipeline, COVID-19 sort of fits across the intersection of those a bit in terms of starting off maybe as a natural thing, but how it's unfolded. Affordable housing, great input here. So what I'd like to do now is move to hearing the perspectives of people who have been thinking and experiencing this in their countries of origin and as they connect in their work. And so if it works, I don't think Kurlan's been able to join us. Let me just double check my messages here. She's very sad. She sent me a bunch of sad emojis that she can't join. So I feel so sorry. We'll be sharing her email address. You can see it on the screen. And I am sure if you are interested in what's happening in Haiti or in her foundation, she would love, love, love to hear from you. I know one of the main reasons she wanted to be part of this session, and I think Comfort may address this in her remarks. We'll talk about this connection across borders is so, so important as we think about what's happening. So I would encourage you to send her a word of encouragement or reach out if you're able to. But with that in mind, I think I'll have you start, Pat, with Kurlan's remarks about some of her experiences in Haiti.
Okay, thank you. So here's words from Kurlan. Haiti is facing a number of crises that alone could be described as disasters, but together create a very difficult situation for Haitians, especially women and girls. In addition to its social and political conditions, Haiti is well known for being struck on a regular basis by hurricanes, tropical storms, torrential rains, floods, and earthquakes. I myself have been witness to many massive natural disasters in Haiti, among them Hurricane Jeanne in 2004, causing at least 3,000 deaths, of which 2,800 perpetrated in a town called Gonaive. In 2010, the country was hit by an earthquake of magnitude 7.0 on the Richter scale, killing 100,000 to 300,000 people and leaving the population in massive despair. Of course, women were twice as more targeted in these catastrophes. They were sexually abused and also experienced violence in the evacuation camps. Many cases of sexual violence were reported being committed on very young children of ages 3 and up. Lesson learned: after the recent earthquake struck the southern part of the country in August 2021, many families preferred camping in their own backyards to avoid being twice victimized. One of the main challenges that organizations face is the lack of finance that prevents them from providing proper assistance to victims. Most of the local organizations don't really have stable financial conditions or a reliable funding partner. They use their own limited resources to survive. Thus, when a natural disaster occurs, these local organizations have the will to bring aid, but don't have the financial stability prepared to do so. It would be a great opportunity if organizations like mine could have at least one international partner that can provide funding and other emergency trauma packages so they can give an adequate response to women in such crises. In 2020, when COVID-19 started in Haiti, my foundation organized trauma response assistance for women who lived in rural communities. We gave food kits, soap, alcohol, Clorox, plastic buckets with faucets, and so on. We hardly got any funding at all. Instead, we had to collect money from the members of the foundation to accomplish the mission. Something needed to be done because we knew that women would be the first victims of this pandemic. Since the assassination of President Jovenel Moïse, Haiti is like a ship with no captain. It can be sunken at any time. People live in constant fear. We fear going out so as not to get kidnapped, because nowadays kidnappings occur at every hour on every block. And the ransom money ranges from $100,000 to $1 million, which results in many families having to sell their houses and other valuables to get their loved ones back. Kidnappings, crimes, and violence are perpetrated on a regular basis in the country, but are extremely more frequent in Port-au-Prince, where I live. Public institutions become weaker and are unable to respond to the need of the population, particularly the justice and health systems. Turnover in leadership causes interruption in actions that were previously taken by government. At Fondazione Essentielle, we help raise the voices of women and girls. We focus on education programs while seeking scholarships to allow more girls to go to technical schools or college. Last year, we organized 2 focus groups of survivors with global rights for women. On International Women's Day, we discussed the nature of domestic violence and how women should raise their boys for a better society. We talked with women about their rights and options for self-care and interrupting abusive behavior when possible. It was done so because there won't always be police authority or other institutions to come to their rescue. These are the precautions needed to be taken in order to survive in Haiti. We hope to change the system and establish tranquility and peace among the female community. We continue to fight as one to bring such awareness, and we hope you can give us the proper platform and resources to do so.
Thank you, Pat. I so wish Kurland could join us.
I know.
But we're thinking about her, and she truly is, you know, a leader in raising these issues and responding locally. It was, I could say more, but I think I'll let her words stand. So Comfort, I'd like to turn to you next and welcome you to share your own reflections. And you've been involved, of course, in your home country of Zimbabwe, but also as you've moved to Minnesota globally. And we've talked about a range of ways of thinking about the crises and how disproportionately they affect women. And I'd like you to speak a little bit about your thoughts on that.
Absolutely. Thank you so much. So thank you again for those who joined us. My name is Comfort Dondo, and I'm born and raised in Zimbabwe, but currently Minnesota is my home, away from home. As I was thinking about this topic and the definition of disasters in the context of climate change, I was thinking a lot about just disasters caused by, like environmental disasters. But we broadened the definition, trying to think of the intersectionalities of how disasters impact the women and girls that we serve. So our organization is currently based in Minneapolis, Minnesota, but we do global work, including Zimbabwe. And today I want to talk about Zimbabwe as a case of a nation that is going through a disaster. Zimbabwe is in what we call like a political disaster. Starting with having a president for 37 years, we've only known one president up until 2017, when we had a coup d'etat. I know many people do not like to use that language about that. We had a coup d'etat, but that is what it was. Essentially, our president then was kicked out of power by the military. And since then, we've had what I would like to call a disastrous and ruthless political climate. We've had tyrant leaders, for lack of a better word, who uphold their power by use of violence and silencing of civilians. We've had shootings of civilians in broad daylight and the world watching and nothing done. I paint this picture because I love Zimbabwe. And sadly, right now, Zimbabwe is essentially what the late Desmond Tutu called a basket case. We formerly used to be the breadbasket of Africa. We have over 90% unemployment rate, leading to a massive brain drain than we've ever had as a country. This then leads to the knowledge that whenever any nation is in crisis, women and girls are disproportionately impacted. And this is the status case of the Zimbabwean women and girls. In Zimbabwe right now, the women and the girl child are the most disproportionately impacted, including the access to jobs. We have a lot of cases in our organization of women who are being trafficked. I've had cases in the Middle East, in other parts of Africa, even in the US and or Europe, because women are so desperate. And I also want to say thank you. Thank you, Sam Wangi, for the comment, because I wanted to say earlier on, today I chose to speak. And as I speak, I put my family at risk. I put myself at risk. But I realized that my silence is just adding on to these acts of violence. So I speak knowing very well that I might not be able to go home and or my family might be in danger. This is the current state of our nation. Women and girls, because they're disproportionately impacted and the huge rates of poverty. We have a lot of young girls being sold into sex slavery. Essentially young underage girls being trafficked. I'll give you some examples of the calls that I get on my WhatsApp. We have a mom with an underage girl who has been molested by a family member who's influential. She tries to report to the police. The influential perpetrator pays the police off. So by the time we send our attorney on the ground to try to do some investigation and or take some DNA tests after the rape, there's a lot of delay up until we cannot get evidence. And the police silences the mother and the child. And so these are the kind of cases that we keep seeing because we have a lack of governance. Women and girls are disproportionately being impacted. If we have domestic violence cases, which are very high again in our community because of just the stressors that are happening. Last time I was home, there's high rates of substance abuse that I've never witnessed growing up because people are jobless and they're just feeling a lot of hopelessness. And we know what happens when people use substances. High rates of domestic violence. We have a really highly patriarchal and very, very rooted in our colonizers' ways of doing things. So I guess the degradation of how women and girls are devalued, how women and girls are treated. If a woman is to report, there's not much of a response. I remember growing up and when witnessing police officers asking, women, what did you do? What did you wear? This is still happening in the 21st century. I also want to highlight a very high profile case so you can have a good picture of how the woman on the ground in Zimbabwe is defenseless and it doesn't really have a voice, and why I chose to speak up today. Mary Chiwenga is our second lady. I still call her second lady because there's not been a divorce. She was married to our vice president, General Constantino Chiwenga, who ousted Robert Mugabe out of office. Mary Chiwenga has had children with the general. Their relationship probably had some misunderstanding or they broke up. but the general has taken her children away from her for the last 2 years. Mary, I should also say, is really under some bad medical conditions. We suspect poisoning, and they have not allowed her to leave the country for better care, because right now, as we speak, in Zimbabwe, we do not have a healthcare system. So you can imagine if a woman like Mary Chiwenga, who was married to one of the most powerful men in Zimbabwe, actually, I want to say the most powerful man in Zimbabwe, because he was the general, if she does not have a voice, and I invited her to come to this platform today, and I think the reason she's unable to come is the fear. The fear I hear from her when I talk to her, the fear of speaking up, because she doesn't want to be finished off, as she says in her own words. If a woman like that cannot speak up and is silenced, what kind of nation do we have? I think we don't have a governance in Zimbabwe. In terms of Mary's situation, we've also reached out to a lot of women's organizations on the ground. There's silence from most of them, and I don't blame them. I've seen some of them coming to this platform, speaking up about other issues, specifically around climate change, the surface issues, but not really addressing the issues on the ground. And I understand that silence very well. If I was in Zimbabwe, I would not even have the privilege to be speaking up in this platform the way I'm speaking up. So the women on the ground, the organizations on the ground are very much scared to share and or to speak their truths, because there's always silencing and repercussions. We've had advocates disappear from the face of earth in Zimbabwe. Yes, that happens in my country in the 21st century. And the world hears about it, but there's just silence. My good friend, Dewama Vinga, a human rights lawyer, recently died in very, very suspicious ways, and there's been nothing said about it. So this is the country that we're living in, that my fellow Zimbabweans are living in, and there is just silence. And women and girls are suffering in silence. I also want to bring about some of the environmental floods that have happened in our country. The Eastern Highlands floods, for instance, where hundreds of people died without response from our government. This also disproportionately impacted women and girls, because in Zimbabwe, women do run the home. And at the end of the day, they're the ones that have the burden of caring for a family if there's a death, and when there's poverty. Women are usually the ones trying to make those ends meet. I want to say, as far as elevating the work that is done on the ground in Zimbabwe, it's really difficult. It's very difficult for the survivor organizations and or domestic violence programs to do the work in Zimbabwe, because there's no rule of law in Zimbabwe. There is a lot of silencing. And I want to say, I think one of the only ways I can think about, as my fellow panelists mentioned, to creatively collaborate partnerships with organizations that are able to bring their voices to platforms like this. I believe this is a good start, but again, I want to say it is quite a very scary step to take, to be speaking up against a regime that is known to be very violent. This afternoon, I was on a local Zimbabwean TV station. I was being interviewed it was a women's program, and it's Voices of America based in DC. And they showed me a video of a man who was literally skin coming off from his back. He was beat up by our government because he was speaking his truth. So this is what happens when you speak your truth and we are trying to fight for the rights of those who are marginalized. And so I stopped by today to just share with you the perspective of another kind of disaster that could happen when a country for me has broken down and there's no rule of law, there's no governance. We see that the abuses of women and girls are so much deep, to the point where the abuse is the abuse of human rights. And I wanted to say that I really believe at my core that women's rights are human rights. And when we have a nation that does not even acknowledge human rights, where do the women and girls fall? We're at the backside. And so that is my sharing today. My heart really aches Every morning I hear from a mother whose daughter has been raped. As a survivor myself, I feel very helpless. When I look at women like Mary Chiwenga, I feel very helpless. This month, we're bringing a woman to Mayo Clinic, and her face was burned by acid. She is currently in Zimbabwe, and she's going to be coming here to the US to get help because we do not have a healthcare system. In closing, I want you to imagine this. In the 21st century, in my home country, a country that has over 57 minerals under our ground, including nickel, and the world's almost 20% of the world's platinum that we use in our electric cars here in the West. In that country that is so rich, because I don't want you to get it mistaken, Zimbabwe is not poor. It's very resource rich, but lacks governance. In that kind of country, we don't have hospitals. I think what will stay with me and why I'll keep speaking up is 2 women that I've witnessed giving birth on the ground. 2 women giving birth on the ground in a country that has that many minerals. I think we can do better globally, as a global village. I think we can do better. I hope those stories stick with you as we continue this discussion, just thinking about what is our part and what does our silence really perpetrate. Thank you so much.
Thank you, Comfort. I hope you've been able to see some of the messages coming in while you've been speaking. Thanking you for your courage and reflecting as well. Let me move us to a couple of things that I think these stories really elevate, and then we can move into talking about sort of what they may mean. So clearly, these 3 features of disaster, I think, are really prevalent in the stories, and I think they bode well for, I know a number of our participants are in the United States or in North America. They may be in situations which are perceived to be sort of more stable, and so we want to unpack this a little bit. We know that disasters really reveal and they reinforce the inequities that exist where they happen. And I think the conversation both with Comfort and the words from Kurland sort of elevate that, talking both about sort of time-specific disasters and flooding and earthquakes, but also this fracturing and lack of governance and who it's harming, right? And what's unfolding. So they both reveal and reinforce inequities, which means by implication that if we want to work to prevent violence against women and girls, we need to be about working on those inequities as well. They also reveal, and some of you have put that in the chat as well, that these disproportionately affect women and girls, and particularly those on the margins. I would also say this on the second point, that these losses, arise from systematic oppressions like racism, patriarchy, and as Comfort said, kind of the legacy of colonialism. And both Zimbabwe and Haiti have experienced that most definitely, and the US has experienced it. And we want to think about how the way of colonization has impacted even how we think about our solutions and who has expertise to offer. A third feature of disasters is the conditions associated with the disaster event, and the aftermath and the response actually increase violence against women. And some of you have posted about that as well. And recognizing that gender-based violence is on the increase here. We wanted to share and invite Comfort and Kurland to speak, to elevate and connect, start or add to that process of connecting and hearing, even in situations that might not be as discrete as one earthquake or one moment, but include the political disaster scenarios where the loss of governance, because of course one can imagine that that's what breaks down in disaster. And it also doesn't improve in any way once maybe a natural disaster or climate change disaster is added to it. So I'd like to pause for a minute though and find out what your reflections are. I'd be interested if you have comments or thoughts that you want to add at this point, or questions you would have for Comfort. Unfortunately, Kurland can't respond to questions, but I have worked with her quite a bit. And the context in Haiti, I wouldn't say I speak for her, but if you want to know more about our work. So, so if there's anything, if you want to, we can go to some polling and other content in a minute. If there aren't any questions, we may have some after the next round, but I did want to invite, put information in the chat if you have a question, or if you know how to use your raise your hand feature and want to speak your question out loud, Sophia can look for that and unmute you. Let's give it a minute here, Comfort, in case, before we go on. As you're thinking about your questions, I'd also just reflect, of course, some of you who work in this field may know that even in the United States during Hurricane Katrina, some of the reports about sexual violence occurring in the Superdome or as people were relocated. I was struck thinking about that as I talked with Kurland about her experience in Haiti and recognizing between the 2010 earthquake when people were evacuated into camps. And then as we were preparing for this session, was saying to me, no, lots of sexual assault happened in that context. And so by the 2021 earthquake, that's when people decided to camp in their backyards. A number of us might think about even access to services for survivors during COVID-19 pandemic. My colleague Melissa talks about having interviewed a survivor and talked with survivor as it was happening, and she said, you know, in the US and in I think even in northern Minnesota, and said, I've lost the safe place I go to for 8 hours a day. So she was commenting on how being told to shelter in place or stay at home, the lockdowns were actually creating more of a tumultuous environment for her, putting her at risk. So there's all these ways, of course, that we know there are these angles to disaster. So I think I don't know if you have any other comments, Comfort, otherwise we'll move on to sort of thinking together about creative strategies given where people are at. Do you have any other thoughts or comments you wanted to make?
Absolutely, thank you so much. I wanted to also make a comment about our involvement with working with international students in Ukraine.
Yes, yes.
I'd forgotten about that part. So I want to make a comment around, people always say, a lot of Minnesotans, my Minnesotan colleagues always say, why should we care about the global, like about the global village thing? Why should we care about the globe? And I say, we are very, very much interconnected. And I think what COVID-19 has done, it has really shown us how much we need each other and why we need to care. I'll give the example of Ukraine. As much as we might think that it's a their issue thing, although I have to say I've seen the US really responding in a way, even locally here in Minneapolis, like Minneapolis Foundation. I've seen a lot of where my son goes to school, they've responded. We have a few Ukrainian families there and we're doing food drives. I've been really impressed with people understanding our interconnectedness. So I just want to say that. Thinking about the team that I was working with, trying to rescue these young men and women from Ukraine to go to the Moldova border or Romanian border, that most of the men that I was working with, they were not thinking about the safety of the young women. Of course, I'm a survivor and I'm an advocate, so I'm always putting the safety of young women at the forefront. And I remember at the end when we got them on a bus, we had a reflective meeting that weekend when the war struck, and they were talking about, I didn't realize how they actually apologized. They didn't realize how that would look different when we have a war, and how that just puts women and girls at a disadvantage. So I wanted to point that out, to always be thinking about how women and girls historically, I want to say, are susceptible to being victimized. And so I wanted to share the Ukrainian situation. And then I also want to bring it home here in the US, because I only talked about Zimbabwe. I also want to echo what you said, Laura, around the pandemic has really disproportionately impacted, again, women and girls. And if we're to break it down, women and girls of color, we saw domestic violence shelters being closed because of the rules around social distancing, and there was a lot of need for housing for survivors and victims. And some of the emergency response we had here in Minnesota, for example, was what was available for an emergency, which are hotels. And we all know what happens at hotels. Hotels are the they're the brooding rooms, spaces for trafficking. So it was, in a way, trying to help, but it was also putting women and girls who are already susceptible to being trafficked. And then I saw we have a few participants from Nigeria. I also want to touch a little bit on when disasters happen in the countries that we come from, the global south. So I'm talking about political disasters, political dysfunction. It really leads a lot of women and girls being so desperate. I want to speak about our organization here in Minnesota. We've seen a lot of some African women, and I'll speak for Nigerian women, who are trafficked here in Minnesota. It does not look like trafficking, but they are brought from Nigeria. They're professionals, mostly in the healthcare field. And right now, I currently have a few clients who have worked so many years for their trafficker, and they have not been paid. They've not seen a single paycheck. And they are so scared to speak up because there's a retaliation around their green card or their immigration. So all that is going on, and that's how when some of these political disasters and economic instabilities occur in some of the countries that the victim survivors are coming from, they end up being brought here. And then here on the ground in the US, sometimes we only see trafficking as one thing, but actually our organization has been doing more training to really help our providers understand how trafficking might look like. That a victim of trafficking might be working in your hospital. The nurse that might be giving you the services might actually be a survivor of trafficking. And so I just wanted to share some of those nuances and why I love working with Global Rights for Women. I think it's one of a kind organization in Minnesota that understands that interconnectedness. And I'm hoping and I'm inviting a lot more organizations, whether you do your work locally, to open up a little bit more internationally, because most of the survivors you're going to be serving are coming from all different walks of life. And I think it's important to study and understand on a global scale what those cultures and what those nuances look like. Thank you.
Yeah, absolutely, Comfort. That's thank you for those reflections. It's so well said, because in the example you just gave, of course, and I know you do this strongly in your role, this opening up is one of the key things I know as we've prepared, and I'll talk about it in a moment with coordinated responses, is we want to listen and hear from people, right? It's elevating voices to find out, precisely because it's not just what you might end up needing, it's about even being able to see the ways that even in stable environments, but then in particular in unstable environments, that the exploitation or the victimization is happening, right? Because even as you talked about the situation in Zimbabwe, the experience of the second lady, I think.
Second lady, yes.
Yeah. somebody in a position of power, of course, being able to execute that, we know in violence, right, it sends a message to everyone else, as you've indicated, about silencing. And so that's pretty high profile, but it also means that there are lots of ways that the exploitation or the violence or the silencing is happening we may not know about. And so we've talked about that. When we are in a position, as at least a portion of our audiences, some of us are, in planning and training and thinking about how our response services might operate in general or in a disaster moment, it's that listening and asking those questions, understanding how the systemic oppressions are affecting community members, how lines of abuse are happening now, because making those connections with organizations like yours and others who are active in the community will be so key, both to starting to sort of reverse the impact even in stable times, but then even more so to be able to be a lifeline and connection, as Kurland was asking, for resources, for things to deliver, to get directly to women in unstable, difficult times. So your thoughts are so good. I do see there's a question, right? So Nadia's had a question about what strategies can we use to make women and girls speak out. We'll move into that in a minute, but Comfort, I'd have you think about that. If there are strategies that people who are ready to do the listening might try. And I'll share a little bit about what Global Rights has done as well. And Lucille is saying a mentor has built a hospital in Nigeria to continue to work with communities. That's fantastic, Lucille. So we'll come to Nadia's question in a moment. I think it'll fit in with where we're headed. Feel free to keep adding your comments and questions. I'm going to step in here for Melissa's role a moment, because I know some of you are very interested in what a coordinated community response is. We have at least one person who is on such a team, but we'll do just a very brief thing here because I think the concepts will maybe be useful for everyone. So the idea is that agencies come together. It's an interagency effort to change the climate of tolerance for violence against women and girls. We look, as those agencies come together, they follow a procedure I'll go over in a moment. The idea is to look at institutionalized practices and procedures that might be blocking safety for women and girls, that might be blocking services, and then instead to understand and replace them with practices and procedures which actually centralize women's safety and victim safety and offender accountability. So when you think about who to convene, if you're not already, if the person who's in one, if you want to just add your experiences in the chat, I would love it. But in this situation, I'm going to make 2 points. Very often, at least coordinated community responses in the US are involving community agencies, advocates that work with and behalf of survivors, police, prosecutors, healthcare folks, people who are involved in providing services, and they explore together what is currently happening and what the gaps might be. In this moment with disaster preparedness, I might lean into what Comfort said about if it's a time to widen the lens and really reach out to organizations where we might not be hearing or talking from with those survivors already. We know that really 1 in 10 victims ever seeks help or support, even in the US. And so, and we have we have lots of underserved communities. I would want to emphasize that. At the same time, we have a funded, robust network of services to victims and specialized services around domestic violence and sexual violence. And still, there are many, the majority of people who have experienced sexual and domestic violence do not cross our threshold for some of the very reasons I think Comfort was speaking to. And so this is a time to reach out and understand those survivor voices and maybe talk with people who are in a position like Comfort is, who may be engaging with survivors daily, whether they share that identity on the forefront or not, as she talked about the Nigerian healthcare workers potentially or others. There are people who they may be collaborating on other community venues or around other issues, and finding out if the staff in those agencies have experience and understand violence against women and girls, and might be willing to help you convene a focus group to elevate those voices or to do some interviews. So that's a technique we've often used globally as well. In my personal experience around in my career, is we didn't just go to agencies where you would have to think of yourself as a survivor or pick up the phone, and we went to places where women are gathering or people who work on social justice issues and said, do you raise this issue at all? Do you talk with women about this issue at all? And would you help us listen and learn what their experience is about why they may or may not reach out to the services and the justice processes that we've built. In this instance too, I would just say another group to think about is in fairly stabilized areas where there may be a lot of more human resources or agencies. We could think that, oh, it must go better, but it can also be far more siloed. So there's a part of my career where I was working on response after the September 11th attacks in the US. And I was working on the sort of with experience on the crime victim side of things. And my sole task was to connect with disaster preparedness people, because they're focused on disaster preparedness issues. They weren't necessarily trained to think about the victimization that could happen in that context. And so this is a moment too to reach, and I know at least we have one person who answered the poll today. If they're still with us, they may be interested in speaking, but we really welcome you here, because having conversations across those divides is a really important thing to do as preparation. You know, as Comfort indicated, there's the evacuation. You might be very skilled at that, but if you haven't thought about what it is to put a lot of people together in one place and don't understand the nature of victimization and vulnerability and risk, we won't really protect people in that process. So we need to be in dialogue with each other. Central also to the coordinated community response is looking at current practice. And I've kind of talked about that throughout. You could look at policies, you could look at texts and interview to compare whether or not what's actually happening in practice is what is in the policy. That's a key feature in looking at how institutions account for what's happening in their practice. So I'll say just a little bit more. I wanted to go through this for those, just very quickly, for those of you who want to know more about CCRs. So typically what an interagency group does is they get together then and they centralize a particular question. So I've put here at the center, what are women's experiences in our community during a disaster, or could they be? Maybe you want to think about this before it's happened. Maybe it's a moment. COVID-19 is a pretty universal experience right now, and take the moment to learn what's happened. So the typical CCR process is about identifying, documenting a problem. I'm going from top right around clockwise, expanding understanding of a problem, doing focus groups or interviews. And I think to Nadia's question, that's where we go, is often to talk with agencies where they may interact. And I spoke to that a bit ago. It may not be the places you automatically think about. Sometimes too, we'll hold a survivor focus group or interview and put up posters or flyers, but you don't say we want to talk with women we don't want to make it unsafe for them. So you might say we're doing a women's health session. And then we had a session earlier this week where we talked at length, Global Rights for Women did, about how to safely conduct survivor interviews and focus groups. And if you want more information about that, please follow up with me. And we've got a guide that will be coming out before long. We can also send you some other resources. But long and short, there are techniques to do that. And you think through that and you partner with organizations, depending where you are, who may already have the context, and you find out and partner up and compensate them for their time and their expertise to do that. But you think about how to reach those voices and do it safely. So you'll see in this link, basically it's an inquiry process is the long and short of it. It's identifying a problem, seeking, and then going to gather information, talking about the information you're gathering with other agencies so it's not so siloed. And then you're thinking about what the proposed solutions could be, and you test them out. You train people then to adapt, and then you always go back and evaluate, did we have some unintended consequences? This is quite wordy and quite involved. It has some really powerful results. Global Rights for Women has definitely been a part of working on CCRs and some institutional analysis processes. There are places across the US, particularly in the Midwest, that do it as well. But I was reflecting, and I'd like to invite you to reflect with me, particularly you, Comfort, but also anyone listening, about what that might look like in unstable times or an unstable circumstance when maybe moving more quickly. And I think we've touched on a few strategies throughout, but maybe we could just talk briefly about that. So here's what I brainstormed. I think there needs to be kind of a rapid assessment. What's currently happening? What's broken down? What is happening? What isn't? Hopefully you form those relationships in advance and can kind of know who to contact. And then there's a fantastic guide in the US here. I'll share the link at the end with you on responding to sexual violence and disasters. But one of the things learned in the COVID-19 pandemic in the US is that there wasn't much information going out about whether you could still call the police or walk in during the pandemic. So developing, I think, ahead of time and then executing pretty quickly a communication plan. What are we going to do? Will we be open? Are we open? Are we doing things remotely? Are we not around? And we need, when I say add people, remember it's that idea that your local resources might be overwhelmed. I've also been active in places where they've developed statewide, could be nationwide response teams where people with expertise, you could, and maybe have made these connections in advance, you could invite in to sort of shore up and support so that, because we know responders, as we've heard both from Comfort and Kurlan, are affected as well. Your families, your businesses, your thinking about your own stability and what's happening and your own evacuation potentially. And so it was represented quite well here by Comfort and Kurlan talking about outside global agencies that might be able to help with financial support or be sort of sister partners. But this could happen in a local region as well. Then I think one of the larger things too is if nothing else, and I think we're hearing this right now in Ukraine, to identify, document, and give witness to the abuse and violence. If nothing else, that's what we need to be about. And Comfort, you've done that so well. Kurlan does it in her written comments, and when we talk with her, does that really well as well. If we are in a position to organize, to plan, we do have some resources. Of course, we want to, again, always push to think about survivors on the margin. They are experts. And not only as survivors, but as Comfort was saying, even in her experience in the US, people who have lived and experienced for a long time without using systems that the rest of us may rely on have strategies and ways of thinking about operating without them. And while we want to repair that injustice, we also want to really elevate and learn about that expertise in those settings. It's also time to then quickly hear from responders. How are they adapting? Are they, as Comfort was saying, they may have an expertise in one area. Are they even thinking about gender-based violence? Are they even thinking about what's happening? Are they what they're normally able to do, a safe shelter to take someone, a moment to interview? Are they not able to do that? And then I think there needs to be a communication across those, using those interagency contexts to rapidly innovate and problem solve, to address the barriers. And then, Kurlan gave this in her presentation, right? Her group just said during COVID, we need to take supplies, and we'll go through this is an example of this. We'll go to our board and we'll ask for financial donations, and we'll show up with soap and other kinds of things. Well, we know how to do this in the coordinated community response context, in this more formalized team interagency work context. It's a similar idea of reaching out, hearing from people what the needs are, and then going to collect the resources, identifying bridges and barriers to safety, and then letting everybody know, communicating about what's needed, and then start the cycle of listening, evaluating, adapting again. Now we'll talk about some specific ideas, and this resource I want to send you gives some very, very specific ideas. Not knowing who our audience would be, I wanted to leave the CCR conversation there for the moment. But Comfort, do you have any thoughts about any of that before we move to some polling?
Yeah, absolutely. I think you touched on some really key things that I was really thinking about, and I think maybe one that I want to reiterate on is the bridging of the collective collaborative effort model. I think when I think about the work that we've been doing here in Minnesota for Zimbabwean young women, or for Zimbabwean women on the ground, I think a lot about how international funders, for example, are thinking about supporting programs on the ground in Zimbabwe, but they're not thinking so much about those programs. Yes, they need the support, but to what extent are they able to help the women on the ground if they silence, right? So there might be programs, so to think outside the box, there might be programs that are on the other side of the, between the North and the South, on the Northern globe, that may be able to actually do more work, and starting to think about how are you funding, how are you distributing your resources? Because I really find it very powerful that we're able to help a woman who's on the ground in Zimbabwe, who's a survivor of acid attack, and to be able to bring her from Zimbabwe, in this particular instance, with our additional own personal resources and fundraising. But if we could have resources that would target this kind of collaborative partnership with one of the best healthcare medical systems in the world, Mayo, and this would not be our first survivor. We've had a lot of survivors on the continent, in Kenya, Zimbabwe, Botswana. We've had Mayo Clinic doctors either before COVID go to Africa and volunteer and help our survivors. So just think about how those collaborative working partnerships work. Even to my colleague in Haiti, she really emphasized on that, and I think it's really important to think about it, to think about how organizations that may be doing work on the ground and off the ground are getting those resources, so they're able to build that bridge for survivors. Yeah.
No, I think that's very well said, and in all the ways, the conversation and support, right? Knowing you're not alone facing it, the financial resources, the ability to maybe impact those organizations already there, connecting people. Yeah, absolutely.
Even thinking about organizations like Global Rights for Women, sometimes we might think, oh, they're based in the US, so how is, but you guys are definitely, I know you are doing a lot of work in different parts of the world. So thinking about it that way. Yeah. I think I'm going to skip this poll for now. What I would love to do is invite people, this is just open-ended, and you can also use the chat. We'd love to hear what you're thinking. If you would rather speak for a bit, feel free to let us know that and signal Sophia. But some of you have a lot of experience, I know, and I've been thinking about this topic. In kind of an unstable environment, what do you think interagency groups could do to keep women safe? So this might be places where I think Kurlan
spoke about this with the turnover in ministry, folks, you know, when the coup, when the president of Haiti was assassinated. Comfort's spoken about this with the coup d'etat, right? There are things that lead to instability, or even COVID-19 might have changed and shifted things so much. What kinds of things could people be doing in those environments to prepare and mitigate for the harms? Those of you, it looks like, might be needing to head out. We have some resources we'll share at the end, so please do watch the video. But wonder if anyone has any strategies to think about. I can share some in a moment if you don't. Can you think of anything, Comfort, that even in the middle, like if you were thinking about your own creating safe spaces, if you're thinking about your own situation, sound like the floods were coming again, needing to evacuate, what kinds of things would you start doing? Or what, in addition to what are you already doing that you think other people could replicate?
Absolutely, thank you. I saw Cheryl. By the way, Cheryl is very dear to my heart, because she runs one of the places I call a model that we should all look at. Sarah, it's a women's, I won't mention the name, it's a women's shelter that houses a lot of immigrant women who are victims of torture, at least from my experience. And she said safety, which is exactly what I was thinking about, creating a safety net. So sometimes in the context of Zimbabwe, for example, or in the context of any political upheaval, I would say that reaching out to a safety net. So just establishing some safety nets outside of your own, right? Right now, one of the major projects we're taking on is the massive rape cases with cultic leaders in Africa. They're very powerful on the ground. Survivors do not want to come to speak up. But right now we are creating a safety net that will allow them to share their stories. And that safety net includes them being transplanted from the ground to being in a safe space. We have some survivors now in the UK in a safe space where they can now speak up and actually share their stories. So I would say for unstable environmental preparation strategies, for me, it would be safety net, just creating a safety net. And I think, Laura, you mentioned earlier on around documentation. If you're in crisis, are you going to have the time to document? But I'm thinking if you created this safety net, it might give time for that documentation, because that is very critical in eventually prosecuting whoever is being charged. So, yeah.
Excellent point. And that reminds me too, maybe this is less about unstable times. I guess it all depends on the continuum. But thinking and watching what's happening now unfolding in Ukraine, thinking about the communication linkages, right? And what happens, you know, will we be able to use WhatsApp and other mechanisms people are using actually to great effect to share stories, some of the creative ways that that's coming out on in a variety of ways to sort of document and show, right, what's happening, and hopefully communicate, getting people to safety. Yeah, excellent. Thank you all. Oh, ensure their physical resources. Yeah, excellent. Yeah, we'll make these available too. Thank you all. And Nadia is saying temporary assistance, food, non-food items. Yeah, very basics as well. So people aren't having to rush to sort of get those and move out of safe spaces to get them, right? Good. So in more stable environments where there might be more time to prepare, or a moment to prepare and think about a particular thing that might unfold, what kinds of things might you think about? What might you think about doing? Particularly if you're in that, if you're in an agency right now that provides services and you have a good lens on this, how might you connect with people who may be in positions of decision making or emergency responders? If you're in a coordinated community response group, an interagency group that is meant to prepare, what could you be doing? If there are things you can think of here.
Laura, I can one thing that I can think about also is safety planning.
Yeah.
If it's a more stable environment, so having a safety plan that makes sense for that particular individual. So you could have a basic safety plan, but I think it's a per individual basis. That's how we've been doing the work here. Some safety plans for some women, for some survivors, they are not ready to leave quite yet. For some, maybe they are ready to leave in 2 weeks. So you just adapt that safety plan and let them lead. Let them lead in how that safety plan looks like. Of course, you can contribute, to it, but normally, like you said, those with lived experience are experts, and they will lead the process of what that safety looks like because they are in that environment themselves.
That's excellent. And it makes me, and those of us who work with survivors, have some of that experience. What I want to tie it to the CCR approach might be, see, the thing is, if people who are involved in disaster scenario planning or working on CCRs, if you have some ideas or are connected to people who know what the disaster plan is, flooding that will be coming, right? What communities might end up being evacuated. Then if you communicate those to those agencies working with survivors, they have the information that can help them do that individualized planning, right? Comfort. So so that's would be very, very helpful as well. And the part of CCRs to do is even to share, think about how do we share what we know and we can expect will happen, what our priorities are, where to go, what the numbers might be. We'll have a community-wide number that will be published. Those are the kinds of things for people to get real-time information. We'll be holding briefs daily, whatever it might be, and pass those on to the agencies and community leaders, and they can then engage with survivors about and women in their environment about their own safety planning. Yeah, good thinking. Well, I wanted to share. I'm going to let you put in questions. I think because our time's short, I want to get to a couple other slides. Feel free to put your questions in the chat. We've been inviting them along the way, and I don't think we have any unanswered. So let me just do a couple more thoughts. One is when we think about what each of us can do, no matter our role, I wanted to come back to the stable and kind of destabilized. Top of the list, hear from survivors, right? We can do that. You've heard that in what Kurland was doing it. You've heard it what Comfort's doing, and they work and are thinking about these issues in pretty destabilized contexts where governance has sort of fallen away. Those of us who work in fairly stable contexts, we have the ability and can go hear from survivors. We need to make that a priority. What about our current policies? What did people learn about the last thing they went to? What in the wisdom of communities or elders have they faced and experienced when their community faced something in previous decades or generations? So hearing from survivors, top of the list. Connecting, true in both environments. We've spoken a lot about that. In stable contexts, we have a little more room and time, and we should be using that to really elevate leadership from Black, Indigenous, people of color, and anyone else on the margin. And that might be contextual depending on your country or your region, of course. But for all the reasons we said, it's very important, and it is a very practical element to disaster preparedness because of the expertise those folks will hold, as well as the increased vulnerability due to systems of exclusion and oppression, colonization. There's an opportunity to conduct a community needs assessment, look at asset mapping, look at strengths, needs, challenges when we're in a fairly stable time. And I think the corollary idea in a destabilized context would be to just maybe it's not a formal process, but as we've said, you're reaching out to other community agencies. You're saying, what assets, what strengths do you have going for you? How can we interact to reach those women and children or protect those community members. So thinking about the services that can be adapted and how now, so here during COVID-19, more I'm familiar with the whole conversation about how would remote interviews be done? Would police conduct interviews remote, sort of online? What are the pros and cons? How do we safely do that? Those are things we can take from what we've learned in recent moments and then think about what adaptations did people make, what worked, what didn't, and start thinking about what might be useful in the future. We talked about documenting and giving witness. What Comfort and Kurland have done so well for us today, I think, is continue to raise the issue, speaking in human rights language, and bringing witness to what's happening to help us have the information we need to maybe organize between global North and global South, between regions, between countries, between communities. The idea of creating mutual aid networks is a little tied to that, isn't it? We may have more formalized language for that in a stable context, but it's this idea of what can you expect from me? What will I be able to do? Could you come to my aid? And reaching across borders as they've given that example. And I think in a more stable time, anytime you need to address systemic causes, it absolutely, but those of us who may feel like we're working in more stable moments, definitely taking that up, because that's going to matter tremendously. What we learn in doing that is going to impact what we have, our capacities and our insights for those moments when acute disasters, I'll say, maybe unfold. So those were some thoughts. Sophia shared here some of the resources. I'll put those up, and I want you to click on those links. The National Sexual Violence Resource Center's handbook on sexual violence and disasters is really, really quite good. And I'd say if you are on a CCR or an interagency group, that's a good spot. There's some other good resources there, and also our email addresses. So I'll put that on the screen. So I haven't seen other questions or comments, would certainly invite those in our last few moments here, but I want to leave maybe the last word with you then, Comfort.
Thank you. Well, I think in closing, I just want to say thank you so much for this platform. It is not quite common to be able to have a platform where we can bring the voices of those who are most unseen, most unheard, and usually most victimized. So I really appreciate Global Rights for Women for the tremendous work that you do globally. And for the participants, I saw some of my colleagues and friends. Thank you so much, especially for the men. Thank you for caring. I really love men who uphold the rights of women and girls. I think this is what's going to change the world, when men support our efforts. And I welcome any feedback and or just reach out. I think Sophia put my email, and I'm looking forward to continuing to be a place that can where women and girls who are unheard, where I come from, can come to, and then bring it on such platforms. So for that, I'm very, very thankful. Thank you so much, Laura.
Thank you, Comfort. I really appreciate your time with us today and bringing those stories, elevating those stories and experiences, and your expertise. I can't thank you enough.
Thank you so much.
So Lucille, you're sharing information about financial education and mindset support. Feel free to put your email to us, and we can, if you're wanting us to share that back out, we will include that when we send that back out. So I will, on behalf of, I think we're at time. And so on behalf of Global Rights for Women, we work to see women's rights as human rights, as Comfort said earlier. We work globally around the world at the invitation of organizations in the host countries, including our own. And we thank you for thinking about this topic with us today, and most assuredly thank Kurland, and our thoughts are with her, and Comfort, and just deeply appreciate your expertise and leadership in helping us think about this topic. And thank you everyone for the joining us and your comments and participating in the poll as you were able to. Best wishes and keep safe.
Thank you.